Hi, my name is Yodit Wongelemengist, Cultural Mediator for Amharic speaking patient. Born and raised in Ethiopia, moved to Seattle early 1980s, attended University of Washington, earned my Bachelor Science degree. I started working Harborview 1994. I have been working with community household program for 30 years. I started when the program started with Dr. Ellie Graham and Dr. Kerry Jackson. So at the early start of this program, I was working patient who came Ethiopia, newcomers from Ethiopia, and with young children and pregnant women. I help patients with medication compliance. For example, patient prescribed a medication that they need to take, in the morning and night. So they skip the morning part because of there is a fast. So one of my patients, when she came to see the provider, they just try to tell him and say, just try about it to say. Then I step and explain to the provider because there is a fast going on, they don't take the medication in the morning. So by doing that, he'll help the patient and the provider to, better explain to the patient, also to modify how to take it. So my patient population is now elderly, chronically ill, and with complex medical issues. So this is an example of my cultural mediator role. 45 years old, Amharic speaking patient. He is an international medicine patient with type 2 diabetes and cognitive delay. He was admitted a few times at the hospital and discharged home. In 2023, he was admitted again and ended up in ICU. And then he was about ready to be discharged. Then I raised my concern, explained to them that he is cognitively delayed, he can take care of himself, he can take his medication, he doesn't eat well, take care of himself. So in last, like the past time, he was discharged home, he will be ended up back in the ED and ICU. Then after a meeting with a med team and primary team and myself and the social worker and the CCN, we all agreed to discharge him to the nursing home. Since he's discharged to the nursing facility, less ED visit, less hospital admission, and a better health outcome. So the best rewarding thing is, working as a culture mediator for 30 years in Harborview. That's seeing my patient, happy because they're, ensured that they're getting the best care in Harborview by, us educating the culture to the provider to better serve them, and patient, is great to see the patient happy and that they know they are getting the best care and they know the provider knows a little bit about the culture.